In this video, you'll get a quick overview of Vibrant's NeuralZoomer Plus test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. A major study released by the Lancet Neurology showed that, in 2021, more than 3 billion people worldwide were living with a neurological condition. This accounts for more than 40% of the world's population, making neurological conditions the leading cause of illness and disability worldwide. And this also marks an 18% increase in the overall burden of these conditions since 1990. In the US, the burden of neurological disorders has also risen significantly. Between 1990 and 2017, the absolute number of incidents, prevalence, and fatal cases of neurological disorders increased, largely due to the aging population. Some of the most burdensome included Alzheimer's disease and other dementias, traumatic brain and spinal cord injuries, and migraine. Vibrant's NeuralZoomer Plus is a blood test that measures IgM and IgG plus IgA antibody response to structures, tissues, cells, and chemicals in the brain and the peripheral nervous system. And it also includes the infections panel, which detects IgG and IgM antibodies to viral and bacterial antigens linked to acute and chronic nervous system infections. This test can detect underlying inflammatory responses that may be causing symptoms related to mood, memory, aging, balance, movement, pain, and more. The NeuralZoomer Plus is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and then dice the wafers into tiny microchips. Then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 96 or 24 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The NeuralZoomer Plus sample report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page. Especially the part where it says, reference ranges have been established using 2,000 healthy individuals. And also the part where it says, a classification of green denotes the result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range. And the classification of red denotes a result that is elevated with respect to the normal reference range. The summary shows the elevated and moderately elevated results along with the interpretive comment. And the full report lists the levels of all markers, including demyelination antigens like antitubulin and anti-myelin basic protein, blood-brain barrier disruption markers like anti-S100B and anti-glial fibrillary acidic protein, also optical and autonomic nervous system disorders such as anti-aquaporin 4, peripheral neuropathy antigens like anti-GM1 and anti-GM2, also neuromuscular disorder antigen like antibodies to the acetylcholine receptor and voltage-gated calcium channels. Brain autoimmunity markers such as anti-cerebellum, anti-Purkinje cell, and anti-amyloid beta, as well as markers of brain inflammation like the anti-NMDA receptor and the anti-dopamine receptor. And lastly, infections, including cytomegalovirus, Epstein-Barr virus, herpes simplex virus 1 and 2, human herpes virus 6 and 7, and streptococcal A. Current and previous results populate side by side so you can compare the IgM and IgG plus IgA titers over time. If you want to learn more about antigens that are outside of the reference range, scroll back to the summary and read the interpretive comment. So, which patients would benefit most from this test? Well, patients experiencing symptoms and conditions related to neurological inflammation or autoimmune disease, such as ataxia or balance problems, optical decline, muscle weakness or atrophy, chronic pain or fibromyalgia, traumatic brain injury or a history of concussion. Also, conditions like multiple sclerosis, Huntington's disease, and Parkinson's disease, as well as infection-related conditions like PANDAS and PANS. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the NeuroZoomer Plus, consider the gut zoomer, as a growing number of studies suggest that the gut microbiota plays a significant role in maintaining the integrity of the blood-brain barrier. Although the exact mechanisms remain unclear, current research indicates the involvement of the vagus and sympathetic nerves, immune and endocrine systems, and intestinal metabolites such as short-chain fatty acids and bacterial lipopolysaccharide or LPS. Also, consider the wheat zoomer for a comprehensive look at intestinal hyperpermeability and elevated LPS contributing to brain permeability. Intestinal permeability syndrome has been linked to autoimmune diseases, so identifying the root causes and healing the gastrointestinal tract lining can help accelerate the reversal of neural autoimmune disease symptoms. The food sensitivity test is also useful as certain food antibodies can cross-react with neurological antigens, leading to autoimmune reactions in the nervous system. Identifying and removing these antigenic foods may help to reduce the risk of neurological autoimmunity. On the same note, consider the lectin zoomer, since research has shown an association between antibodies to aquaporins and neurological autoimmunity, particularly with aquaporin 4. Therefore, it may be beneficial to assess reactivity to individual food aquaporins as part of a personalized nutritional elimination plan. And if you're looking for a comprehensive investigation of multiple autoimmune conditions, the autoimmune zoomer is a great adjunct. And finally, total immunoglobulins to evaluate baseline levels of total IgA, IgG, IgE, and IgM. Serology testing is based on normal functional immunoglobulin production, and the total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, Vibrant's NeuroZoomer Plus test uses highly specific and sensitive microarray methodology to measure immune reactivity to structures, tissues, cells, and chemicals in the brain and peripheral nervous system. And it does this alongside 7 of the most common infections associated with autoimmunity of the nervous system, helping identify the root cause or causes of many neurological symptoms and manifestations. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.